Okay, thank you. So welcome again, everyone, to IPHA's third Thursday Lunch and Learn web series, organized by the IPHA Education Committee. My name is Deborah Thompson. I am a board member for the Iowa Public Health Association and also the chair of the IPHA Education Committee. So we dedicate this time every month to sharing our successes and even some of the detours public health takes to meet its goals of seeing everyone live their most healthy lives and making the healthy choice the easy choice. The point is to connect, learn, and strengthen the voice for public health in Iowa. So we are glad you're here, and hopefully you'll tell more people about it, and we'll continue to grow our audience. So today we're talking to Katie Jones. She is the manager of the Iowa HHS Comprehensive Cancer Control Program. Her a partner in the cancer community, would be here, but she's sick. Rachel Schramm, a friend to many, the program manager at the Iowa Cancer Consortium. So we'll miss Rachel, but we're still happy that Katie could make it and join us today. So in the spirit of our 100th anniversary that's going on all year, IPHA turns 100 this year, we asked Katie and Rachel to put together a presentation that would give us the cancer prevention and control history in Iowa over the years. So before she starts, just a couple of housekeeping items. Please put your microphone on mute and turn off your video so everyone's able to enjoy the presentation and discussion. If you have any questions of Katie while she's speaking, please use the chat function and we will field those questions. But after the presentation, you'll also have a chance to take yourself off of mute and ask Katie a question yourself. So with that, Katie, please start your presentation and thank you.
Great. Thank you, Deborah. Thanks for inviting me to present today. I'm really excited to be here. So I'm just going to go ahead and dive in. I will say this doesn't really cover the whole 100 years of IPHA's history, but it does cover about 50 years of some milestones in cancer prevention and control. So, all right, I'm going to try and cram a lot in here in this hour, but what I'm going to go over is first a little about cancer in Iowa, then some brief history of cancer prevention and control in Iowa, and there's some national stuff in there too. A brief history of the cancer programs at Iowa HHS and the formation of the Iowa Cancer Consortium, and also an overview of the Iowa Cancer Plan. So first, cancer in Iowa, 2 in 5 Iowans will be diagnosed with cancer in their lifetimes. As I'm sure we all know, cancer is a very common chronic condition. Iowa has the second highest age-adjusted cancer incidence rate in the U.S. We're behind Kentucky, and we're one of the only states with an increasing rate of cancer. Also, there are many cancer-related disparities. For example, in Iowa, we have the second highest incidence among the Black population, and then we also have the third highest cancer mortality rate for Black Iowans compared to other states. So that's something to note also. And this data comes from the Iowa Cancer Registry. And you might be wondering, what is comprehensive cancer control? That's the name of my program. So this is really looking at cancer prevention, cancer screening, cancer treatment, and also quality of life for cancer survivors. So it's sort of that whole cancer continuum. And then also there's a focus on cancer disparities throughout and really looking at which populations are disproportionately impacted by cancer. This is from the Cancer in Iowa report. This is from the last year report. The new one's coming out next week, so there'll be a new graph for next week, but this is showing the estimated new cases of cancer in Iowa. And so you can see here that breast cancer is the most common type, followed closely behind by prostate, and then lung, and then colorectal and melanoma. Those are the 5 top most common types of new cancers. And then this shows the estimated cancer deaths in Iowa. And you can see there it's a bit different than the incidence. So lung cancer is the #1 cause of cancer death, and then colorectal is #2, pancreas is #3, and then we see breast and prostate. So I'm just going to keep moving along. So you might be wondering what's driving Iowa's high cancer rates. We are also wondering that and looking into it. The Iowa Cancer Registry has done some really excellent work diving into this, and there isn't one kind of really easy answer. With Kentucky, it's pretty clearly related to tobacco, since they have really high tobacco rates, and a lot of what's driving their high cancer rates are tobacco related cancers. For us, it's a little more complicated, and it seems like it's likely that there's a variety of different kind of things going on. So the Iowa Cancer Registry put this together. They found that these 4 cancers really seem to be largely driving Iowa's high cancer rates: lung cancer, melanoma, breast cancer, and prostate cancer. Those are also 4 of the most common types of cancer. And these are cancers where Iowa is just, higher than kind of the national average. If you remove these 4 cancers from consideration, our incidence rate is a lot more like the US average, although it's still a bit higher. And the Iowa Cancer Registry, I really recommend. They have a lot of great resources about these specific cancers too, and they have a nice resource specifically about these 4 that I've linked to in the citations. I also want to plug that the Iowa Cancer Registry, in partnership with the Iowa Cancer Consortium, Holden Comprehensive Cancer Center, and Iowa Rural Health Association, is working to enhance community engagement and education around cancer prevention and control across all of Iowa's 99 counties. This is called the 99 Counties Project. There's actually one going on right now at the same time for one of the counties. This project entails providing county-specific cancer profile reports, cancer-related presentations for individual Iowa counties, and listening to community concerns. So they are literally organizing 99 separate meetings, one with each county. So definitely, if you're interested in that, keep an eye out for that. Or let me know and I can help get you connected to. I think a lot of the contacts are public health departments for helping to organize these, and other connections that they have in the area, like cancer centers. I do want to talk a little about cancer disparities. So basically, cancer disparities are impacted by many factors, including social determinants of health, behavior, biology, and genetics. We know that people with lower incomes, lower health literacy, longer travel distance, or who lack health insurance or paid medical leave are less likely to have the recommended cancer screening tests and to be treated according to guidelines. And people who do not have reliable access to healthcare are more likely to be diagnosed with late stage cancer. And for many types of cancer, the earlier you catch it, often there's a better prognosis. And you might be wondering, like, what is a cancer risk factor? This is really important for preventing cancer. It's something that raises the chance of getting cancer. So having a risk factor does not mean someone will get cancer. Even when a person with a risk factor is found to have a cancer, it doesn't necessarily mean the risk factor caused the cancer. Some risk factors can't be changed, while some can be controlled or modified, although social determinants of health can impact that, and social determinants of health have a major impact on people's health. These are some examples of risk factors. Cancer, we call it cancer, but it's really a variety of different diseases that are impacted by have different risk factors often. So these are some that are sort of potentially modifiable, but can still be impacted by social determinants of health. Things like using tobacco, not being physically active, UV or ultraviolet light exposure, like from the sun, or using tanning beds, drinking alcohol, not having the HPV vaccine or the hepatitis B vaccine. Those are the 2 vaccines we have that can prevent certain types of cancer, or be exposed to radon, for example, in our homes. Not modifiable. So these are risk factors that we can't modify. A huge one for many types of cancer is age or getting older. Huge risk factor. Just as you get older, your risk of developing cancer goes up. Also, inheriting certain gene changes. So that would be like the BRCA gene, if you've heard of that, for breast cancer. Having a family history of cancer, having a personal history of cancer. So if you've had a cancer, that's a risk factor for developing cancer again. And then also your race and ethnicity. All right. So these are some milestones from the last 50 or so years, a little over 50 years. This is from the Cancer in Iowa's previous report from, I think it was 2023, that celebrated the 50th anniversary of the Cancer Registry. And they did a really nice job highlighting some major milestones in cancer prevention and control. As you might expect, anything that has to do with those risk factors is also going to be impacting cancer. So anything related to tobacco, for example, and there's been a lot of major milestones related to tobacco over the last 50 years or before that. So I just kind of wanted to highlight some of those risk factors and just an awareness of things that impacted those risk factors also are involved with cancer. So here, this timeline, and I pulled this right out of the Cancer Registry report, starts with 1971, and that's when Congress at the federal level passed the National Cancer Act. In 1973, the SEER program funds the formation of the Iowa Cancer Registry. And I apologize, there's a lot of acronyms on this. Highly recommend checking out the original report, which explains a little more of this. But SEER is the National Cancer Institute's Cancer Registry program. So Iowa's Cancer Registry is funded by the National Cancer Institute and is part of the SEER program. The CDC actually also has a cancer registry program that works with SEER, and they kind of compile the data together, but there's a separate kind of funding and program for that. But in Iowa, we are just through the SEER program. So that 73 is when Iowa Cancer Registry started. Um, in 81, the FDA approved the hepatitis B vaccine. So helping to prevent certain types of cancer, since hepatitis B is linked to developing liver cancer. Um, and then in 1982, cancer became a reportable disease in Iowa. In 1987, the North American Association of Central Cancer Registries was formed, and it's also often called NACER. In 1991, the Iowa Cancer Registry published its first Cancer in Iowa report. In 1992, the Cancer Registries Amendment Act was passed. I believe that was at the federal level. In 1993, what was then the Iowa Department of Public Health, or Legacy Iowa Department of Public Health, now part of Iowa HHS, was awarded CDC funding for breast and cervical cancer screening for folks who are uninsured or underinsured. So that was when that program first started. And we still have that program, the breast and cervical cancer early detection program. And then there also at-home testing for colorectal cancer became an option nationally for the first time, making it a lot easier for a lot of folks to get screened for colorectal cancer instead of having to go through a colonoscopy, for example. There was kind of easier, lower barrier methods for colorectal cancer screening. In 1996, the U.S. Preventive Services Task Force recommended colorectal cancer and breast cancer screening. So that was a new recommendation from that group then. In 1998, the CDC formed the National Comprehensive Cancer Control Program. That is what funds the program that I work in. So they formed that program. In 2001, Holden Comprehensive Cancer Center at the University of Iowa received the NCI National Cancer Institute designation to be a comprehensive cancer center. So I don't know how many of you are aware of this, but NCI basically has given this comprehensive cancer center designation to some cancer centers across the US. Holden is the only one in Iowa that has that designation. Not every state has a cancer center that has that designation. So that first happened in 2001, and Holden had to accomplish a lot of, different requirements to achieve that. And also in 2001, then IDPH, now Iowa HHS, received funding for the Comprehensive Cancer Control Program from the CDC, that National Comprehensive Cancer Control Program. And this helps form the Iowa Cancer Consortium, since part of that funding is to have a cancer coalition formed. And for our state, Iowa, that is the Iowa Cancer Consortium. They serve as our cancer coalition. All right, I have a few more here. So more milestones from the last 50 years. In 2005, Iowa Administrative Code amended the definition of reportable cancers. In 2006, the FDA approves the first HPV vaccine. The HPV vaccine is turning 20 next year, which is very exciting. I remember getting it in 2006. Must have been right around 2006. I was finishing up high school and then got my other doses in college. So that was very exciting to about six different kinds of cancer there. In 2007, the Iowa cigarette tax increased, which did help lead to a reduction in tobacco use. And we know tobacco is still the leading preventable cause of cancer. Um, in 2008, the Iowa Smoke-Free Air Act passed. And then also at the national level, the U.S. Preventive Services Task Force recommended kind of additional colorectal cancer screening, including the at-home tests. In 2009, IDPH, then Iowa HHS now, received colorectal cancer funding through a colorectal cancer. I think that was state appropriated funds, but we also do have a colorectal cancer grant um, as well from the CDC. Also, Congress at the federal level passed an act that allows the FDA to regulate tobacco in 2009. In 2010, Iowa HHS received funding from the state legislature for cervical cancer screening and colorectal cancer screening, and Congress passed the Affordable Care Act, which also made it so that a lot of these cancer screenings, basically anything that's recommended by the U.S. Preventive Services Task Force with the A or B rating, has to be covered at no cost by health insurers. In 2012, Iowa HHS received funding from the legislature for cervical cancer screening as well. And in 2013, received funding for that colorectal and cervical cancer screening. And the U.S. Preventive Services Task Force made its first recommendation for lung cancer screening. So that was new in 2013. And we're still trying to get the word out about lung cancer screening. Our lung cancer screening rates still remain very low. In 2016, Congress passed the 21st Century Cures Act. And in 2018, Congress passed an act related to childhood cancer treatments. And then in 2022, the Governor Kim Reynolds signed the Gail Orcutt School Radon Safety Bill, which basically requires schools in Iowa to test for radon and mitigate if the radon levels are high to protect students and teachers and staff. Okay, I'll just keep chugging along. So I just wanted to briefly go over some of these programs that we have at Iowa HHS. So we do still have this breast and cervical cancer screening program. It's called Care for Yourself. And this provides free breast and cervical cancer screenings across Iowa. This is primarily funded by the CDC, by a CDC grant. There is some state appropriated funds as well. We serve Iowans between 21 and 64 years of age who are at or earn less than 250% of the federal poverty level. There's the phone number here, and coordinators are able to help there, and there's more info at the website. Hopefully, many of you are familiar with this program. We also do have a colorectal cancer screening program. This program, it receives funding from the CDC as well through a competitive 5-year grant that is actually in its 5th year right now. And we just submitted an application for the next 5-year grant. This is a little different than the breast and cervical cancer screening program or the comp cancer screening program, for example, in that it is competitive. So not every state receives funds, whereas with breast and cervical and the comp cancer grant, every state does receive funds for those from the CDC. So with our federal dollars from the CDC, we partner with Iowa's federally qualified health centers, FQHCs, and local public health agencies to increase colorectal cancer screening. We work really closely with the Iowa Primary Care Association, and it serves low-income Iowans ages 47 to 75 to increase the number of cancers prevented, increase the diagnosis of early-stage colorectal cancer, and reduce colorectal cancer incidence and mortality in the state. With the state appropriated funds that the colorectal cancer program has, they work with Polk County and Black Hawk County to provide some at-home colorectal cancer screening tests as well. I will say too, I am not really able to check the chat really easily, so I don't know if anyone has a question urgently, or we can just ask them at the end too, but please do put your questions in the chat if you have any. So the program I work under is the Iowa Comprehensive Cancer Control Program, and we work with partners to prevent cancer whenever possible and support cancer survivors across Iowa. We partner with many organizations, especially the Iowa Cancer Consortium, which, as I said earlier, is Iowa's Cancer Coalition. We are involved with the revision and implementation of the Iowa Cancer Plan. And currently, we're focused on increasing HPV vaccination, increasing lung cancer screening, and supporting cancer survivors. And this is a picture from one of the annual Iowa Cancer Summits, which is organized by the Iowa Cancer Consortium with support from us through our contract that we have with them. And And there's also a lot of other programs at Iowa HHS that involve cancer, as you can expect, since there's so many cancer risk factors. Just want to plug, we have a radon program, we have a private wells grants program, there's a hepatitis program, an immunization program. In the behavioral health division, there's the tobacco program, which helps fund Quitline, Iowa for tobacco cessation, and also does some alcohol reduction activities. There's healthy living and active living focused programs. And then we also have other chronic disease focused programs, which share a lot of the risk factors for cancer, for example, diabetes, heart disease, and stroke. This is the Iowa Cancer Consortium's organizational chart. So we are really fortunate here in Iowa that our Cancer Coalition is a 501c3 nonprofit organization that really allows them to get additional funding so they're not reliant only on the CDC and state appropriated funds that we contract with them through Iowa HHS. They also have a really strong relationship with Holden. So this just shows how they're structured as a 501c3. They have a board of directors who are elected by the consortium members. They have individual and organizational members. They have various work groups, committees, and then they also have staff. I do want to note here, though, one of the staff members that's listed here, the CDC Public Health Associate. This org chart will need to be updated. This consortium has had 4 CDC Public Health Associates. This is a process where, if you aren't familiar with this, it's a CDC program where host sites apply to have a public health associate placed in their organization, and then if they're selected, the CDC tells the associate where to go, and it's a 2-year position for younger, newer folks in public health, often younger, um, often more recent college graduates, and they often move from across the country. But unfortunately, and it's a 2-year position, it's a probationary position the whole 2 years. Unfortunately, they were all let go on Saturday. They received a termination email. And so the current staff member at the consortium, Bree, was informed that she was let go. So she is no longer working at the consortium, but the consortium does have some funding that they have available if she would like to contract with them afterwards. Her position was supposed to be over in October. So that is unfortunate. Um, and if you're interested in that, just let me know too. I don't know if there might be other organizations in Iowa that are impacted also. I know when I was at Lynn County Public Health previously, we had PHAPs there too. The Iowa Cancer Plan. So now I'm going to talk about the Iowa Cancer Plan. Hopefully, many of you are familiar with this resource. This serves as a guide for implementation for cancer prevention and control activities. It's not just Iowa HHS's cancer plan. It's not just the consortium's cancer plan. It's for anyone in Iowa who's working on cancer prevention and control. And as you can see, with all those different risk factors and different types of cancer, it's a lot of us. Even if you're just working on, one part of it, it's still part of the plan, and hopefully the plan is still a useful resource. So it provides context for making key decisions for populations and communities. And it also provides a shared statewide vision for cancer control, which builds momentum and energy around various cancer control issues. It's entirely online. I just wanted to pull out, this is from the Iowa Cancer Registry. They pulled out various strategies from the Iowa Cancer Plan that could really significantly reduce the burden of cancer in Iowa. These are tied to those 4 cancers I mentioned earlier that the registry has identified as really fueling our high cancer incidence rates. So they have identified effective tobacco prevention policies, for example, cigarette tax and smoking cessation treatment, radon mitigation strategies, policies that increase opportunities for sun protection in outdoor settings, increase awareness about skin cancer prevention and screening, or decrease the use of indoor tanning beds. As of January of last year, 44 states have laws that restrict minors' use of commercial tanning devices, 20 of which completely ban the use of tanning beds, but we do not have any currently. Policies to decrease alcohol consumption and binge drinking, and enhancing opportunities for Iowans to access nutritious foods and be physically active. These are all things that are included in the Iowa Cancer Plan as options and activities or policies that could be implemented that would impact cancer. I should have a disclosure, though. I cannot lobby, and I'm not saying, vote for these or anything. Just highlighting that these are options that are included in the cancer plan that are evidence-based. All right, this is what the Iowa Cancer Plan looks like. So again, it's all online. And this is just a screenshot to show you on the left-hand side, there's the different sections or chapters. And then if you click on one, so for example, this has been clicked on chapter 2, prevention and risk reduction. Then you'll see there's an overview, there's these little tabs and a bunch of different priorities. So here's an example of a priority. Priority number 4, increase immunization rates for vaccines shown to reduce the risk of cancer and protect cancer patients from preventable diseases. So this is where HPV vaccine fits in and hepatitis vaccine. And then this shows that we have interactive data tables throughout the cancer plan. So for example, this one is showing a table that shows the increase the percentage of adults between the ages of 45 and 75 who met the U.S. Preventive Services Task Force for colorectal cancer screening. And I know this looks kind of weird because it's a screenshot, but basically it's showing if you hover over that graph, it pops up a demographic breakdown info. This is from the Behavioral Risk Factor Surveillance System, or BRFIS survey. And if you hover over it, then you can see, okay, here's the breakdown of the rate. So the overall rate for Iowa is 67%. But when you see the breakdown, you can see, oh, males have a lower rate at 64%. Or Black Iowans have a slightly lower rate. Hispanic Iowans have a much lower rate at 32% compared to 67. And you can also see their uninsured folks have a lower rate as well. And then there's a slight difference in the metro versus non-metro there. So um, we also, I just wanted to plug the Iowa Cancer Registry has some really great interactive cancer maps. And actually, I'm realizing now this, I should have updated this slide because they have some newer tools too for kind of, you can play around with different types of cancer and really see where in the state there are kind of higher incidence rates. So for example, with breast cancer, it's higher in urban areas compared to rural, but there's some other types of cancer where you see higher rates for melanoma. It's higher in the northern part of the state with colorectal, which is what this older cancer map is showing. Colorectal was sort of higher in the western and southern parts of the state. So that's another part of the piece of the puzzle, is that these different cancers are sort of higher in different parts of the state. All right. So if you're wondering, what can I do? I'm passionate about cancer. I know many of us have had loved ones impacted by cancer or have been impacted ourselves. I definitely recommend checking out the Iowa Cancer Consortium and becoming a member if you aren't already, or if you are a member, looking into different ways you can get involved, for example, in a work group. You can learn more about your cancer data in your community through the Iowa Cancer Registry and through their website. You can look at the Iowa Cancer Plan for specific ideas of things that you might want to implement. You could set up a meeting with your clinic, hospital, or cancer center in your community to talk about what their needs are. And also, again, to plug the 99 Counties project too. Check that out if you're interested in that. So here I have a bunch of those citations. Definitely recommend checking these out, especially the Cancer in Iowa reports. And yeah, I think we have plenty of time for questions. So
Yeah, thank you so much, Katie. I think the first thing I'm going to acknowledge is the amount of wonderful information that you put into this presentation. I mean, I'm blown away by how much is in your mind, and how easily it comes out. Is there any place where Katie may need to kind of go back and refresh on something that she said? Feel free to ask for that too. But if we want to start with any questions, I see that Angie has raised her hand. Angie, you want to take yourself off mute and ask?
I was trying to do the clap emoji.
Oh,
Great job, Katie. This was wonderful.
thanks,
Thank you for
Angie.
coming today.
I know we do have some more time too, so I'm happy to show the cancer tools of the Cancer Registry website if people would be interested in that as well. I don't know, but
let's let them pause for a second and digest everything that we've learned, um, just in case there are any more questions. I was curious, Katie, you touched on the knowledge that University of Iowa has. I wonder if there are other educational institutions who are considered trusted resources to the cancer community, aside from the Holden comprehensive cancer program?
Yes, nationally, the American Cancer Society is absolutely a great resource, great website, lots of wonderful information on the American Cancer Society website for that. And then I think, there's I mean, there's so many great organizations across Iowa working on cancer. There's Above and Beyond Cancer in the kind of, which is based in the Des Moines area for cancer survivorship. There's the cancer support community of Iowa and Northwest Illinois at Gilda's Club. I think I got that right. They used to be called Gilda's Club Quad Cities. Great resource for cancer survivors. They do things statewide, but especially in the Quad Cities area. Um, yeah, and also, of course, many other cancer centers too, the Mercy One Dr. Deming Cancer Center in Des Moines and Unity Point Cancer Center. I mean, there's just a variety of really great people across the state. In rural areas, there's lots of great cancer centers that serve rural populations. St. Anthony's is a great example. Um, yeah, I mean, the Cancer Consortium as a coalition, you can check out on their website all the organizational members they have there. They have great member of their board. Um,
Yeah. I
yeah.
guess I meant like those are great, and I appreciate the national would you say the Cancer Society? I guess I mean like in terms of research. Like
Oh, in terms
who
of
else is doing
research.
research? Who else is going to be continuing to churn out reliable data and information? Um, just in case we need to expand the resources that we check as public health professionals, if they're not going to be
Yeah.
the traditional ones we're used to.
Holden is I would say the biggest cancer researcher organization in the state, in terms of kind of classic cancer research that you might think of. Like clinical trials. But that said, there's a lot of cancer centers across the state that also engage in clinical trials work. And even many cancer centers don't have that NCI designation of the Comprehensive Cancer Center, but there's another designation of, I think it's like a community cancer center. And I think, for example, Mercy One has that in Des Moines. And they are involved in clinical trials work as well. And a lot of them work in partnership with Holden or with other cancer centers. I mean, Mayo, and there's one in Omaha that have the NCI designation. So in terms of like clinical trials type work, that's what's going on. But then also Holden does some other research as well that's not just the clinical trials. For example, we contract with them with a state appropriation for melanoma research, but a lot of the funding is, NCI grants and things. But that said, I guess I'm not entirely sure of other, cancer researchers. There might be some other cancer related research in other organizations. I'm
Yeah.
not as in the research world.
Yeah. Well, and even just for the population health research too.
Mhm.
Um,
Well,
just
and
one.
University of Iowa has the preventive, okay, let's see, CPCRN, Cancer Prevention Research Network, Cancer Prevention Research and Control Network. I always need to spell it out. But they have the CPCRN, which is part of their prevention um, research center run by
Okay.
Dr. Natasha Askelson, and they do research as well.
Thanks, Katie. There's a couple of questions in the chat. One is from Jamie Moore. Will the Iowa Cancer Consortium still be able to hold the Iowa Cancer Summit this fall? Do you know?
Yes, that is the plan. The Iowa Cancer Consortium receives, they get sponsorships for that, and yeah, the plan is for that to continue. And then are there any resources in Southeast Iowa that can provide free colorectal cancer screening like Polk and Black Hawk counties? Yeah, that's a great question. Angie, let me look up where the FQHCs are, that the colorectal cancer program partners with, because I believe they partner with one in that region. Um, Actually, I have it written down here where all the different ones are. Okay. Because that's a great question. Unfortunately, the state funding is quite limited, so that is why it's Polk and Blackhawk. But all right, let's see here. Okay, the participating FQHCs are all care health center, community health care, community health centers of Fort Dodge Infinity Health, Community Health Centers of Southeastern Iowa. So Community Health Centers of Southeastern Iowa is an FQHC that provides colorectal cancer screening, at least for FQHC folks. Crescent Community Health Center, Eastern Iowa Health Center, Primary Health Care Incorporated, and Promise Community Health Center, that's in Waterloo, and River Hills Community Health Center. But like I said, that 5-year grant is wrapping up this year, and then we'll find out about the competitive application later.
And can I also put a plug in for the Cancer Consortium programmatic grants? So they offer, I believe it's yearly, we do that. Sites, cancer centers, and local public health agencies can write for funding to do cancer prevention, screening efforts, survivorship. So it's great to be on their newsletter list to get that information.
Thanks for plugging that, Kristen. Yeah, they have an annual request for proposals process where they can issue grants to local organizations. Yeah, thanks for plugging that.
Other questions? Katie, do you mind going back to your policy information?
Yeah, and I'll plug the consortium has a policy work group as well. A major partner in that is the American Cancer Society Cancer Action Network, which does lobby. The American Cancer Society's Cancer Action Network does. The Iowa Cancer Consortium does not lobby. Of course, I do not lobby as a state employee funded by the CDC. But yes, these are some following strategies. These are strategies the Iowa Cancer Registry pulled from the Iowa Cancer Plan to sort of point out, hey, these are some things that are in the cancer plan that are related to the 4 types of cancer that are really driving Iowa's high cancer rates.
Yeah, I was just looking at, just thinking about the last time Iowa has revisited some of the policy discussions. So with tobacco, I know there's a bill about the casino exemption, which was kind of a regret in not passing with the Smoke Free Air Act. I don't recall the last time we've raised our cigarette taxes. I know we increased the age to 21 over the past few years. And then we always have funding for smoking cessation treatment through the department. Can you think of anything else we've done recently?
I think the tobacco tax was last raised in 2008.
Okay.
So I could be wrong about that, but
And then radon mitigation strategies. Remind me what the Gale Orcutt bill did. Do you know off the top of your head?
Yes,
I'm not quizzing you about policy, but I
there's a
believe in you.
great video about it that the consortium made as part of the cancer plan that I can link to. But that basically, so if you don't know who Gail Orcutt was, she was a very passionate radon lung cancer survivor advocate who was also a teacher. And she sadly died of lung cancer caused by radon. But because of her advocacy efforts and others' advocacy efforts, this law was passed that basically requires schools to test for radon, since Iowa has high radon levels, and radon is a colorless, odorless gas that's the second leading cause of lung cancer and the leading cause among non-smokers. And schools in particular, there's interest there because kids spend so much time in their day in schools, and of course the teachers and staff as well. And so this law was passed, which requires the schools to test for radon and mitigate if the radon levels are high.
Great explanation. I remember the tanning bed bills. I haven't seen any for a while, but my recollection of those subcommittees was the tanning bed industry, because everyone is organized. So the Tanning Bed Association would come to the meetings and kind of weigh in on their skepticism of the relationship, and they must have worn them down in terms of not seeing any real champions. Actually, I think the champion was Rob Taylor, and he's no longer a legislator. His wife is a physician that was heavily involved in the Iowa Medical Society. So other than the melanoma funding that's been pretty regular in the HHS appropriations bill. I can't think of anything that is directly tied to tanning, or can you?
I think I think actually the Iowa Senate did pass a ban in 2015, but it did not pass in the House.
Yeah.
But I'm not aware of a big push for that currently, but the Iowa Cancer Consortium, I should mention, does give out grants specifically, or not grants, but you can apply to get sunscreen from them for events like baseball stadiums, or I've seen them at Big Grove Brewery in Iowa City. They had a big gallon tub from the Iowa Cancer Consortium of sunscreen. So that's an environmental level change that they support as well. Yeah, I would definitely say in terms of policy, I would recommend getting connected with the Iowa Cancer Consortium's policy work group, or American Cancer Society Cancer Action Network. They're gonna be more informed than I am about the policy landscape. But at the Iowa Cancer Summit last year, two state legislators did present, which was great. A Republican and a Democrat who are very interested in cancer, and I believe they have proposed some radon mitigation focused bills as well.
Can you think of who they are?
It's Dr. Austin Baith is one of them, and the other,
Awesome.
and he's from Ottumwa, and I'm blanking on his
Hello.
name right now.
Was that?
But they presented, and their presentation was great too, and I think there might be a recording of it, but that was a really interesting presentation at the Iowa Cancer Summit last year.
Okay, I see. Elizabeth put Wills.
Yes.
Yeah, it's important to remember these folks when we are together, in case some of us are in those districts and would be willing to reach out and just say thank you for considering it. And then alcohol consumption and binge drinking. I feel that substance use treatment and prevention is probably one of the more underserved advocacy and education areas, especially alcohol consumption and binge drinking. I can't think of anything we've done around those things. I was and then enhancing.
I'll say too, the policy landscape with alcohol has sort of changed a bit with COVID and the loosening
Mhm.
of a lot of kind of um, alcohol related, laws, for example, like with restaurants and things. So just something, there's have been some changes, but not necessarily to reduce alcohol consumption.
Let's see. Ty Burkhart, you're awesome for helping Angie out. And alcohol consumption is also linked to cancer. So when bars and breweries do promos, it's a bit of irony, Yeah. Does a cigarette tax also apply to vapes, Katie?
I will admit I am not sure.
I know that
I
it
think there's
was
something being discussed right now related to that, but I am not sure.
if anybody knows, chime in. We are a community who helps each other. Enhancing opportunities for Iowans to access nutritious food and to be physically active. I remember getting a $500,000 for the Healthy Kids 5210 program. And I'm just doing this as I'm not sure that regulation is the best way to go anyways in a state like Iowa, but it's always kind of interesting to recap and remember where our discussions have been when it comes to regulation. Public health is always about education first, of course, but
Somebody's saying in their vapes are not taxed. I just saw that too. Yeah,
thanks,
I
Jess.
just looked. It says to date there is no state excise or special tax placed on e-cigarettes. Vape products are taxed at the sales tax rate, not at the tobacco or cigarette tax rate. And also vape products are not covered by the Smoke-Free Air Act. But individual businesses can prohibit the use of vape devices indoors, but it's not required by state law. I'll put the citation there. This is from the Iowa HHS website.
Nice, good job. So in terms of the tobacco opportunities, it almost seems like there's some fairness issues with exemptions and loopholes in the code. That would be an interesting way to present it. But anyways, thank you for indulging me on that, Katie. If no one else is going to ask you questions, I might as well take take the policy questions. That's where my heart is. Let's see. There have been efforts to raise the tobacco tax the last few years, but nothing this year so far. And then Tanda's asking, does anyone know how strongly the nutrition messaging is surrounding cancer prevention?
I guess, could you elaborate on that question a
Maybe the
little bit more?
connection, just
Yeah.
even understanding that there's a connection.
Yeah, I think a lot of people are not fully aware of the connection. And it kind of depends on the type of cancer too. So yeah, but I would say I think a lot of people aren't. And then also I will say too, there's a lot of kind of misleading information that can happen with cancer. I'm sure many of you are aware of this too, of sort of like, oh, apple cider vinegar, like can prevent cancer. And it's like that's not true. So yeah, I think with nutrition, it's more that there's a lot of evidence about how healthy eating and certain types of food are tied as a risk factor to certain types of cancer. The big one that comes to my mind is um, red meat, but especially processed red meats. There does seem to be a relationship there with certain types of cancer, like colorectal cancer. And then, but as you can expect, I mean, cancer is very complicated to untangle the risk factors, and nutrition is very complicated too. So, but that's just one that comes to mind where there does seem to be a relationship there. And I can pull up, I think there's a nice, NCI has some nice
Tanda, what do
info
you
too.
think? I'm curious what your opinion is on that question you asked.
So I was just trying to get a sense of what information exists in the state of Iowa related to cancer and nutrition. How, like I asked, how strongly are those messages? What is it that people understand the myth? Like Katie, you just said, apple cider vinegar prevent cancer. I'm trying to see what resources currently exist. So I'm at Iowa State University, and I'm also with Extension and Outreach. So I'm listening because I'm trying to identify where there are opportunities that we can partner with certain other agencies and bring in a stronger nutrition messaging surrounding cancer. So
Great.
that's kind
Yeah.
of where my questioning is coming from. Mhm.
Thank you for the
Ooh.
question. Yeah, I really appreciate that question. And I'm sorry I'm not really articulating a great easy response. I did put in there in the chat a link for the National Cancer Institute's page on diet as a risk factor. And it does say, with few exceptions, studies of human populations have not yet shown definitively that any dietary component causes or protects against cancer. But I think just because that causal link is so hard, especially with nutrition, but it does show, it does list some different additives, other nutrients, and other dietary components with possible cancer connections. Alcohol is one of them, and which is sort of a component of diet that I think people maybe don't quite, think of too. Um, but yes, and then the American Cancer Society has some really great info about this as well. And I
Sounds
see,
like a good partnership opportunity that Tanda is offering up too. If you
yes,
give her something that is maybe a handout or videos for the website, I feel like that's what she's looking for. And actually, another hat I'm wearing for IPHA is to lead up the Iowa Public Health History Project. And I was just reading about the historical connection and partnership between local public health agencies and ISU Extension. So if we're gonna come full circle, Tanda, I would love to see us have a successful partnership if Extension is. It sounds like y'all are in the nutrition space then, but
So,
diet.
yes, so I'm the director of the Health and Human Sciences Extension and Outreach. And as part of that portfolio, nutrition is under that umbrella. And I was just thinking, okay, so how can we get some of the nutrition messaging so it can be more visible, Even though you're so right, Katie, nutrition is so complex. However, I also believe, and the literature supports this, that the average American, their diet really doesn't reflect those nice, healthy messages that we continue to encourage and recommend. So part of that, I think, even when we read and look at the literature, it's not telling the full story, because what diet are they evaluating to say that, well, we don't know for certain how strongly diet can actually increase one's risk, you know? So I just think it's just an opportunity for some partnership and to just provide just more information to the public, considering I didn't know that Iowa was the second highest in terms of incident numbers. So I'm new to Iowa as well. So I'm learning all of this stuff and quite fascinated by it, and just think there's opportunity just to do some more partnering. So Deborah, we definitely need to exchange contact information, because I would love to explore more.
Yeah, that'd be great. Please leave your email address and we'll follow up, and folks take advantage of Tanda's interest. With that though, we've got about 6 minutes. So it's last call for questions, and then I need to read you guys the rest of my script, wrap up script.
Tanda, I just want to echo thanks for bringing that up, and yeah, definitely would be happy to partner with you more. And I'm on a healthy eating and active living group that Iowa HHS has organized, more on the healthy eating and active living side of things. And then there's also breastfeeding group too, that's because there is an association with if somebody has children and breastfeeds, that reduces breast cancer risk too. So there is a cancer connection there. And just trying to kind of make these connections. It's often very siloed, you know, the nutrition world, but it's like, I mean, nutrition also ties in with other chronic diseases, of course, also you know, Alzheimer's and dementia, related dementias, diabetes, stroke, heart disease. There's connections with across the chronic disease world with nutrition. So I did plug in there too. The American Cancer Society has a nice article about diet and physical activity and its relationship with cancer prevention. So just wanted to plug that too. And they have some nice kind of guidelines in there that they recommend.
And welcome to Iowa, Tanda.
Yes, welcome to Iowa. I'm sorry
like,
it's so
great.
cold.
All right,
I
gotta
don't
read
know
the
if you came
script.
from a fellow cold place, but it's very cold this week.
Yes, sorry about the weather. If we could control it, we would. All right, y'all. What a fun conversation. Thank you so much for joining us today. Appreciate Katie's time and expertise. We hope that you, and also thank you all for spending your lunch with us and in community with public health. So we hope that y'all will keep coming back each month. March 20th is the next lunch and learn. More information will be sent out about the topic, but we will be hearing from IPHA student interns who are leading IPHA's work for the annual National Public Health Week. So come and support the students and hear about the activities they are planning that may be in your local area, and you can attend. As a nonprofit organization, IPHA relies on membership dues and sustaining donors to support our mission. If you're not already a member, please consider joining IPHA. Students, if you're on the call, check with your department chair because y'all get some discounts. If you are a member, thank you so much. If you're a sustaining donor, thank you so much. And we appreciate any donation that fits within your budget. And you can join and give at iowapha.org. We'll have the recordings up on our YouTube channel, the Iowa Public Health Association's YouTube channel. And thank you. And we'll see y'all next month. You've been a great audience.
Thanks
Kate.
everyone.
Yeah.